To be fair, the federal government has a lot going on. So, focusing in specifically on dental things is not high priority, although there's a lot of discussion around Medicare benefits and dental benefits associated with that. Obviously, funding to states for Medicaid and Medicare. Lots of rumblings and things that are happening, but we're going to focus on 3 states that are doing some interesting things with dentistry that I think we should probably make some note on. We talked about last week, North Carolina starting to look at corporate ownership, and it's in one of the existing bills. A lot of kerfuffle this week on that particular law. We'll see where that goes. Illinois, I actually want to apologize. I should have brought this news story up way earlier than I am this evening, but I think it's interesting to note a few laws that went into effect in Illinois in 2025 that honestly, as a practicing dentist in the state of North Carolina, if they had gone into effect, would have drastically changed the way we practice. So I think it's really important to make sure that our fellow friends in Illinois know about a few of these changes. So there were a couple of different laws that were passed at the end of the year. One was that now insurance companies will be required to honor pre-authorization unless they can show an extenuating circumstance for why they can then go and deny that. Once a pre-authorization has been issued in the state of Illinois, it would be very difficult for them to go back on that. And I think that's awesome for patients and for doctors who are really trying to do their very best to give patients a fair price and to be very open about what things will cost, even though they can't really control the compensation of that. But another interesting law that went into place that I had no idea existed was the regulation around third-party financing in dental practices. And we're all familiar with these different companies: Care Credit, HFD, Cherry, Sunbet. There's a ton of them on the market right now providing third-party financing to our patients so they can be able to pursue dental procedures, more complex cases than maybe what their dental benefits would cover and what maybe they could just afford with cash. But now Illinois has a law in place that actually prohibits patients, dentists, and employees from filling out financial applications in the office. Dentists cannot provide electronic devices to complete those financial applications, and they're prohibited from advertising or promoting those third-party services while in a patient treatment facility or in sensitive settings, which seems kind of vague. So it's interesting to see what Illinois will do with that, what dentists will be able to do moving forward. If they do offer third-party financing, are they having to do that in a very different way? Does the patient now have to go in the parking lot in order to fill these things out? Anyway, kind of an interesting change because I know a lot of dentists rely on this particular thing, and a lot of companies that offer third-party financing have actually made it very easy for patients to fill it out in the office to complete that pre-authorization so that they can go ahead and secure the financing to be able to go ahead and book the appointment. So I don't know if other states are going to follow suit, but anytime you see a state taking up a charge like that, it does warrant discussion that other states may take a note. We've talked a lot about the Interstate Compact, the licensing compact that would open up opportunity for dentists to be able to move their licensure from state to state without having to go through an arduous process. As long as you're a part of the compact, then the process to move from state to state would be much easier. This was originally kind of a banner that folks were carrying for military spouses. As their spouse was moved from base to base or from assignment to assignment, that their spouses that were dentists would be able to acquire a necessary license in that state to be able to provide that service. So that was the origin story. I think it's sort of morphed into a few different things since then. But Arkansas is now the next state to join the compact. I think now that would put them up to 11, 10 total. Was what was required in order to make it an official compact. And now they have a few additional states to continue to move the momentum forward for this to be a more commonplace activity. The last thing of note, sweet Wisconsin, which made me quite famous last year when I talked about Marquette. This time, they are one of the newest
Was
states
it
offering
Wisconsin or was it Michigan?
I don't know. I don't know. I can't remember now. I have PTSD from that story. Um, Wisconsin is going to be the newest state to offer dental health aid therapist training. So, as many of us have known about for a long time, this mid level provider, which is somewhere between a dental hygienist and a fully licensed doctor, has come online. And we're seeing that more and more in other states, particularly states that have concern about access to care. So, Wisconsin is now offering the training program in order for licensed dental hygienists to take the dental therapy training to move into doing other types of procedures. Most commonly, it is simple restorative and simple extractions. My joke has always been if I knew which ones those were, I could effectively avoid all the really hard ones that I didn't see coming. But anyway, Godspeed to those who have that foresight and that crystal ball that can predict the easy ones from the more challenging ones. But Wisconsin is now offering training. I think that's actually a big step in that, in the momentum of that program and with the dental and with this mid-level provider, because there are 10 or 11 states, I believe, currently that recognize the mid-level provider as a legal entity within their state, but only about 5 or 6 programs currently exist for training for those particular providers. So, as you see more and more of these coming online, then you may see that uptick. And honestly, it's an interesting play because with the compression on dental hygiene and different economics within the dental practice market, will be really interesting to see how this all plays out. And again, would love that magic 8 ball to shake it and ask, how is this going to work out for each of the individual players within the dental space to see if we all come out, winners in the end or if there are winners and losers. So, with that, that's the news.